Here's a secret about low back pain that nobody tells you about. You know that test we always do to check low back pain, the forward bend test? What if I was to tell you there's much more to do with it than just the hamstring length and your low back flexibility? A big part of it is how well can I posteriorly shift my pelvis. Now, give this a try. Line up with a wall right behind you. From here, try to bend forward as far as you can. You're not going to make it very far because you can't posteriorly shift your pelvis. So besides the forward bend test, an easy way to check if your patient has the ability to posteriorly shift their pelvis is check their internal rotation. If the internal rotation of their hips is limited, you probably need to restore that before they can shift their weight backwards. One of my favorite ways to do that is the kneeling RDL. What we're going to do is put our knee up on an 18-inch box and I'm going to shift my weight over. How do I know my way to shift it over? Well, I look down at my thigh, my thighs actually pointed slightly inwards into hip adduction. Now from here, I'm going to take my stance leg and bring it back, and I'm going to do an RDL, basically meaning I'm keeping my hips high as my chest drops down. If you start seeing the butt start moving down towards the heel, recorrect yourself. So from here, chest drops down, hip stays high. I should feel stretch in the outside part of my butt. Now this is a key component. As I'm sitting back up, I want to push my knee straight down into the box to stand back up. Not necessarily just stand back up without that. I would do that for a couple sets of 8 to 15 reps and then recheck that forward bend. You'll be surprised what you see.